on Boston 25 News at 10.
Local nurses upset over their hospital's use of PPE.
I mean, there's not even words for it.
25 Investigates is hearing from Massachusetts nurses tonight. They tell us they're fired up after Steward Health Care gave away thousands of pieces of PPE to first responders while they were forced to reuse their gowns while treating COVID-19 patients. 25 Investigates reporter Jason Law has this heated debate.
We talked with a handful of nurses who are really upset, describing this move by Steward Health Care as a publicity stunt. They say at the same time they were forced to wear their gowns over and over again, they watched their company put out a promotional video touting the donation of 50,000 gowns. The promotional video from Steward Health Care begins with a truck backing up, then cuts to boxes and boxes of personal protective equipment. The company boasts their global supply chain program transported millions of units of protective equipment by land, sea, and air. But Steward's nurses say they have a hard time getting PPE in their own building.
Everyone lost it. We're reusing them. How can you give stuff away?
KIRSTEN RANSOM is a nurse at St. Elizabeth's in Brighton. 25 Investigates spoke with several Steward nurses who said they've had to reuse gowns and masks over and over. So they were stunned when they heard their company had donated 50,000 gowns to the state.
I mean, there's not even words for it about how people felt. We don't have enough ourselves, and you're giving it away in a publicity stunt.
The announcement was heavily criticized by nurses online, and the promotional video was eventually taken down. But Steward's donation drew praise from Governor Baker, who on May 14th said the gowns would go to first responders in Taunton, Brockton, Dorchester, Mattapan, and Methuen.
We're also grateful to Steward for this partnership and their ability to bring this much-needed equipment to the front lines.
SKARBEK, a nurse at CARNEY Hospital, said they were led to believe there was a shortage of PPE. When they found out the company had a stockpile, they were shocked.
It just never made sense in the beginning. What are you holding anything back for? This is when we're in crisis.
It was absolutely outrageous.
DONNA Williams is the president of the Massachusetts Nurses Association. In a scathing letter to Rhett Cavici, the Steward Labor Relations Vice President, Kelly Williams wrote, "I am told when M&A St. Elizabeth's committee members raised this frustration to you in a conference call, you lost your temper and yelled, 'How dare you?' That wasn't a publicity stunt. It is offensive that you would criticize this donation to protect the first responders of Massachusetts."
You can just imagine how outrageous it was to have nurses that were being told by Steward administrators to reuse a gown over and over again, and then to see them donating the very gowns that they were told to reuse in a way that put both them and their patients at risk.
Kelly Williams says around 2,200 nurses across the state have tested positive for COVID-19, but she believes the real number is much higher. The Nurses Association took a poll in late April and found 79% of its members had not been tested.
Every single frontline worker, every essential worker within a hospital facility needs to have the equipment that they need.
A Steward spokesperson told us the promotional video was taken down and is being re-edited because of a licensing issue. In a statement, the company said many of the orders placed in March arrived from international vendors and have been distributed to hospitals across our network. Only after restocking with this new supply were we also able to make a donation to other frontline workers through our partnership with the state. However, the president of the Nurses Association told us nurses are still having to reuse and ration personal protective equipment. For 25 Investigates, I'm Jason Law.
You can see all of our investigations and special reports on the coronavirus outbreak on our website. Just go to boston25news.com.